Hey guys, this is Dr. Clay Williams with Elite Enhancement of East Texas, speaking on behalf of UroFill, the only patented dermal filler penile girth enhancement procedure. I want to share something with you. I'm going to admit I'm a little ashamed of myself. I've neglected to think about the content of this video and record it for you, and it'll make more sense when I get to it. We haven't really discussed much about penile dynamics as it involves having the girth enhancement. Now, let me explain exactly what I'm talking about. Let me paint this picture. Many of you are kind of on the fence. You're on the cusp of proceeding with a dermal filler. You've already decided dermal filler is the way to go, and you're exactly right. But you can't quite decide between UroFill versus one or two of the knockoff versions. They look like UroFill on your phone or a computer screen. It sounds like UroFill. It's something fill, but it's not the same thing. And you keep seeing that we say that we're certified UroFill providers, we're board certified urologists, we trained with Paul Prito, the inventor of the UroFill technique in Miami over about an 8-year period. And you're thinking, well, wait a second. My wife gets hyaluronic acid dermal filler placed in her face all the time. Her friends get it, her mom gets it. What's the big deal? All right, well, I get that. Well, when they're getting the dermal filler, they're getting very small amounts placed in very small controlled locations. And that's what gives you the fill and the robust looking face. All right. But they're also not putting in like, 12, 16 units at a time, because they'd get this big, Pillsbury doughboy look, this big round moon face. So there's a reason why they're not injecting all that. They inject to give it highlights in filler where it needs to be to make it look natural, normal, and attractive. So keep that in mind. Now, I admit there's a lot of dynamic movement of the facial and muscles around the eyes all over. And whether or not we smile, we frown, we laugh, cry, cough, sneeze, there's a lot of dynamics and subtle changes in our facial and eye muscles all day long. I give you that. But I want you to think for a second about the penis. As you go from a non-erect to an erect state. Now, I'm going to argue that the amount of change in the penis when it comes to the length and the girth is enormous, is a substantial amount of difference between all the subtle changes in the face. Now, maybe I'm wrong, but I don't think I am. And I think you would agree. So when you place hyaluronic acid, the dermal filler, if you don't place it in the correct anatomical position, if you inject too much, 12, 15, 20 units at one time, because you want to get all the girth at one time, then as a provider, we can't control that hyaluronic acid. There is some fluidity to it in the first couple of weeks. That's why with UroFill, the patented procedure, we do know the correct anatomical location. We do it under a staged procedure like a clock face, which is discussed on other videos. I won't belabor that. And we avoid the temptation of injecting too much. So when you go from the non-erect to the erect penis with the change in girth and the length, all the filler that we place stays where we place it. It doesn't move and become these big lumpy, clumpy, bumpy areas at the base or the sides or all over the place. And that's what you run a risk of if you use a non-UroFill provider. But let me take that a step further. And this is where I've neglected to do a video and share this with anyone. Hopefully, once the penis becomes erect, it becomes a functional organ, right? I mean, you get an erection, hopefully you're about to do something with it. There's a sexual interplay, oral sex, anal sex, vaginal sex, some sort of penetration. If the hyaluronic acid is not done correctly, if you don't build those robust columns using the patented technique, which progresses over several weeks, then not only do you run the risk of the dermal filler of your cosmetic girth that you invested time and energy and money into, The risk is that it might, move and become lumpy, like I said, going from a non-erect to an erect penis. But what about when you have penetration, where the erect penis, is now full of hydrostatic pressure? It's strong, it's stiff. You're ready for penetration, and you're using it. If the hyaluronic acid has not settled in, if it was done incorrectly, then even at that point, you run even a higher risk of the dermal filler moving into the incorrect place. And now you're having to go back and get more filler and modeling and sculpting to try to fix something that was completely avoidable had you used a UroFill provider. So I am ashamed that I've never done that video before, to think about not only when you go from the non-erect to the erect penis and you're happy that it's symmetrical and everything looks great, but when it comes time to actually using the penis as a functional organ, which is what we want to use it for, if it's not done correctly, then under all that tension of penetration, all the linear and longitudinal stress on the penis, that's when you have a higher risk of the dermal filler moving where you don't want it, where the provider doesn't want it. And the only thing I can tell you to do is find a certified UroFill provider that has a patented technique that is reproducible each and every time it's done. And that's the benefit of UroFill. And I hope that was the final thing you needed to hear to make an intelligent and wise decision. And you'll be on your road to what I think will be an exciting adventure on the way, and each and every step that you go through, you'll enjoy it, and so will your partner. If you have any other questions, do not hesitate to contact me at enhancedtexas.com or any UroFill provider that you so choose to use. You can't go wrong. And so contact me on my website, contact a UroFill provider, ask us any questions you have. And I hope that was the final thing, the final hurdle you needed to convince you to go ahead and make the best decision. So I wish you luck, and God bless you.